So our final speaker is Haja Wurie, who's a health systems researcher with the Rebuild Consortium. Haja brings some really interesting perspectives from Sierra Leone, where she was researching, again, health worker incentives, with the added interest that during the course of her research, the Ebola crisis in West Africa erupted, so bringing some interesting perspectives there too. Thank you.
Thank you, Ben. Good morning, ladies and gentlemen. So I'm just going to be talking about the reflections from the Rebuild project and on how we conducted our research in these post-conflict settings and how they were extrapolated to be used in contexts of protracted crisis. So just a brief overview of the Rebuild project itself. So I'm going to be focusing on one of our projects, which was the Human Resource for Health project. And the aim of that project was to understand the evolution of incentives for health workers in the post-conflict phase and the effects of these incentives on the wider health system. So we worked in 4 post-conflict countries, Sierra Leone being one of them, Northern Uganda, Zimbabwe, and Cambodia. So these are all post-conflict, but different types of conflict and different stages of conflict. So if you were to look, well, you can describe them as being stable. So there were more stable settings compared to protracted crisis settings, but they were still fragile. So in terms of the methodology, we used a mixed methods approach, largely using life histories with health workers, so that gave us a better understanding of their experiences of the incentive environment in the pre, during, and post-conflict phase. And that was complemented by other methods, including key informant interviews, documentary reviews, and also analyzing existing secondary data. So altogether, these different methods helped us to have a better understanding of what was the incentive environment like in these settings, so both in the medium, short term, and long term, and how conflict affected this. And many of the relevant findings emerged on the effect on health workers of the financial and non-financial incentives, and also issues around complex income for health workers in these fragile settings. So if looking at the research uptake activities that we did in country, so we engaged at the national level and also at the international level. So with regards to the national level, in Sierra Leone, it started before the Ebola. So we did the research before the Ebola outbreak, so in the post-conflict phase. But the findings became very relevant during the outbreak. And during the outbreak, we had, during and before the EVD outbreak, we engaged with policy makers. But then if I was to look back and reflect on that process in the pre-Ebola phase, the engagement was not that effective because the use of evidence into policy making we were not there yet. But then a window of opportunity opened during the Ebola outbreak and immediately afterwards, wherein we were approached by development partners and the ministry to provide evidence to support the response. And also, during the response, there were plans for the rebuilding phase, and again, our evidence supported that process as well. So, with regards to the rebuilding phase, we developed the post-Ebola recovery plan, wherein the rebuild evidence was fed into that process. The National Health Strategic Plan was reviewed, and again, we were involved in that process. We had links with the Health System Strengthening Hub that was set up to support the response and the rebuilding phase. And we engaged with WHO, providing, supporting their agenda, with regards to the national response and the regional response, so looking at the 3 affected Ebola countries. And also in that time frame as well, the Human Resource for Health Directorate at the Ministry were reviewing their policies and their strategic plans, and again we supported that process. And then after the outbreak, the pressure then was for us to maintain, to keep that momentum going. So we have continued engagement with the relevant stakeholders. With regards to the international agenda, so as I mentioned before, Rebuild happened in 4 post-conflict countries. So we synthesized findings across these 4 countries, and that in turn informed development of policy briefs to support engagements that we then engaged in within fragile conflict-affected states, for example, Syria and Myanmar, and also working with people. So with that, we were working with people who knew these contexts more than we did, but then we were providing the evidence that we had from our study. And then we also had more general engagement on health systems in fragile conflict-affected states, for example, developing the fragile conflict-affected states strategies with WHO, involved in working groups on initiatives for fragile conflict-affected states, and then engaging with political initiatives to inform that should be informed by evidence, for example, the call to action for UHC in emergencies. So these are just examples of some of the outputs that I've mentioned before. So the peer-reviewed paper, the policy briefs, and the engagement at the national level, providing the evidence from our findings. So looking back and reflecting on how our evidence that we've generated, how these can be used and relevant in other protracted crisis settings. So there's always this window of opportunity that you have to make the most of, wherein it's either an emergency or you're rebuilding or reconstructing the health phase, wherein evidence is then seen as very relevant, becomes very valuable. Doing research in more stable contexts like we did within Rebuild enabled robust research approaches, which probably you would not do in the middle of a crisis, but then we still have data and research challenges that you have to address. And these settings are still fragile, but the findings are highly relevant. And when you're faced with a new shock, like we had in Sierra Leone, so post-conflict and then Ebola happened. And then with regards to national engagement, it's very important that you build and maintain strong relationships in country. And that would then support your research uptake activities, and then you would then identify any capacity building needs that you need, and also to support research uptake and also support national ownership. Within the international space, so international engagement and evidence use in these settings, it requires synthesis of findings that can be extrapolated and then can be selectively used by those relevant actors familiar with the context that the evidence should be used. Thank you.